Get going. Good morning, everyone. Welcome to the first webinar of 2025, January 8th. Happy New Year, everyone. Hope 2025 will be another great one. Um, this event will be recorded, as you can see at the bottom, and it's already showing that it is recording for a while. So Kelly was there bright and early, and it will be placed on our website in case something happens. In case you get a call or somebody pulls you away from the webinar, then it will be recorded and placed on our website, and that goes pretty quick these days. So within a day or two, it should be out there. And if you want to share it with coworkers, other people that you deal with within our business and our organizations, it should be out there. Plus all our other media outlets that we have. We have a messenger and a couple of other things. But what are we going to do today, Kelly? Please show us the agenda. Okay, we're going to show an agenda. We are going to introduce the MOTS team for those of you who are not familiar with everyone. Excuse me. And what our objectives are. Kayla is going to talk about the go live. And Kelly, of course, about facility name changes. I'm talking a little bit about keeping data up to date. Also very important. Jody, our EDI specialist, is going to talk about EHR file prep. And then back to Kelly with multi-factor authentication, MFA, very thing of the moment, definitely. Access to EDI, switching from CE to EDI or from one EDI to another. A little bit about the intro to MOTS that we're still doing because we're still running smoothly with MOTS, and we always have some room at the end for some Q&A, and we'll show you our contact information. So, okay, so this is the agenda. Go ahead and show us the team. Kayla, the MOTS system admin and the new system Rhodes PO product owner. Jody is the EDI technical expert and also co-owner of the Rhodes product. Lisa is the junior system admin of the Rhodes system. And myself, MOTS senior systems analyst, or senior systems analyst in general, because it's for Rhodes, it's for ODE, the behavior health data warehouse that we have, and many systems that people can use my experience and expertise I'm looking at. So Justin is the report specialist for MOTS and will be for Rhodes, and is also our research analyst. If there's anything you want to know about the data, talk to Justin. And Anna as well, MOTS report specialist and data analyst, also for Rhodes, of course. And Mary and Cecilia are two support specialists, the individuals you probably have the most contact with, because whenever there's an issue or you want to get some information, our support team is there to help you. And they will be our Rhodes support specialist as well, of course. And the person who made this lovely webinar and put everything together, Kelly, our Rhodes and Compass Program Communications Analyst. And I think that's a very nice title. Okay, next. What do we do with our webinar? What would we like to do, and why do we do these webinars? Well, information on changes and enhancements is, of course, always very important. If there's anything happening within our behavioral health world, we let you know as soon as we have solid information about things that are changing. If there are upcoming changes, to make sure that you are prepared for it, we also give you all that information. One of the things that we love to do, and I'll talk a little bit about it later, is discuss data issues. If there's trends, analysis, things that we notice or things that you might notice that are going in a certain direction or are the topic in our business at the moment, we'd love to talk about. We also have this a nice medium to get your feedback. If you have any questions or comments, suggestions for any future webinar topics, we'd love to hear from you, and you can use this platform and talk to us. And hopefully, if you have any questions about anything that's going on, we can answer them today. And if we can't, then we'll definitely find the person that will have the answer and we'll get back to you. So that's some of the main objectives. Go ahead, Kelly. And then we go to the Rhodes Go Live update. Kayla, microphone to you.
Thank you, Pete. Happy New Year, everyone. If you had joined our webinars last year, you might have seen that We've pushed the go live date to Q1, and that has remained the same. So once again, we appreciate your patience as we kind of work through a couple of hurdles here at the end, trying to make sure that the system is working appropriately and is going to be able to do all of the functionality that it needs to do upon go live. So we're still at Q1 right now. Hopefully we're having scheduling meetings often. So I hope that we can report out that we have a go live date soon. Back to you, Pete.
Fingers crossed, right?
That's right.
Okay. Cool. Thanks, Kayla. Kelly, facility name changes. You're up.
Hi, good morning, everyone. Happy New Year. Well, we were just wondering if you have updated or made any changes to your facility name or rebranded your practice for the new year or made any other changes to your name or details. Just reach out and let us know. It's just great for us to have all of your most current information and details. So if you could keep us in the loop, that would be wonderful.
Thank you, Kelly. Yes, details are very important because we try to communicate as much as possible. Okay, keep data up to date. Why do we do that? Well, because it's very important that the information that we get is correct and accurate and up to date, because we communicate with the federal government and we provide them with the information that we gather from you guys, and based on that information we get money from the federal government so we can help the programs that there are in Oregon to do good things and improve the quality of the care that we have here in Oregon. So also one of the very important things is the more current your data is, then it will be much easier to move into the new road system. Because if we try to move data that is not correct, it might be harder for the system to import because there might be things that won't really fit into the mold, although it should be the same as MOTS, but you know how that works with new systems. There's always little tweaks and little issues that might pop up. So if you have all your issues solved, then it should be easier transition. So um, we are currently still doing the same thing as Kayla mentioned. The first quarter is our goal, and we are still fairly optimistic. And but in the meantime, please keep doing what you're doing. Don't change anything. Send in your MOTS files, or if you're not an EDI provider yet, then just keep entering your clients into the MOTS system. It's business as usual because we are still reporting from everything and we still have all that information in there and we need all that stuff in there. So make sure your access is up to date. Can you still log in? Is everybody that is working within your organization, do they have the right access? And can they all log in and test it once in a while? And I do remember that is kind of something that you easily forget, but maybe put it in a recurring one in your calendar somewhere to pop up, like log into MOTS. Because also if you don't, your login will expire and you have to get it set up again, and you have to talk to Mary and Cecilia, which is always nice to chat with them, but then sometimes you have to go to our help desk and it can kind of it'll be cumbersome and it take a lot of while. Plus, if then we get the move to roads, then it's usually even more cumbersome to kind of get that going, because then you really get stuck sometimes. So in other words, please clean up your data so that the shift to roads will reduce technical debt. I still like that new terminology. I've heard that a little while ago, and and technical debt means that if there's any issues that can be solved now, please do it. Try not to procrastinate. I know it's easier because it's um, something that we all tend to do sometimes, and especially if we have a lot of other work going on, that this is kind of like, oh yeah, well, we'll do that later. But it's very important, and when the change comes, we really like you to be ready, and so the more ready you are, the easier it is for us to move you and everybody into the new system. So thank you. That was it. And then we go to Jody, the EHR file prep. Go ahead, Jody.
Awesome. Thanks, Pete. So yeah, we added this slide to the deck. I'm not sure if we had it before, but we thought we should. If we didn't, we wanted to bring it out again. So we've had some organizations reaching out to us that are either building a file for their EHR to send to us. Either they're doing it in house, maybe they're working with a consultant. They've got their EHR vendor that has agreed to go ahead and implement this. And if you are building, out the file, what we want to let you know is that we're probably going to recommend that you start your data submission process via the MOTS portal. As we've seen over time, that development and that process and cycle can take a tad bit of time, anywhere from 3 months to 6 months. It really just depends, and so we don't want to hold up your data from coming in. So we're going to encourage those of you who may be signing up for EDI to get in the portal, enter your data, and once your EDI, availability to send data is finalized and ready to go, we have a process. We'll just change that current data submission from the portal client entry to the EDI. And your data will continue to flow then through your EDI submissions. So sometimes we have folks ask, well, can we get an exception for, a gap in reporting? And if it's a short period of time, we might be able to, but 3 to 6 months is quite some time. So if you get that from part of our support teams or recommendations, we just wanted you to kind of have a heads up here. And of course, if you are thinking of doing this development, or you're getting your vendor to do this for you, let us know so we can make ourselves available to those amongst your teams that would need, help with, say, what does the EDI file need? What goes in it? How do we test it? Like there's all kinds of different pieces and aspects to that. And we really try our hardest to make sure that we have myself and or Pete or others available to assist you through that development cycle so that we can help troubleshoot, guide, lessons learned, those kind of things, to make your process as smooth as possible. So just wanted to share that with you. I will go ahead and kick it back to Pete, and we'll see. I don't think I'm next, but I might be.
You
No,
are.
no, you're not.
Oh, you're
No,
not.
it's Kelly is in between there. And just FYI, Justin popped up a very good reminder that one of the things about keeping your data up to date also means checking your active client list, which is a very important one, and of course the monthly anomaly reports. And if you never get the monthly anomaly reports, then that's great because that means your data is in pretty good shape. But also make sure that you know where it goes to and that the contact information is correct. It's what Kelly was talking about. If there's any name changes or individuals changing, then it's very important that we get the right update, because otherwise these reports that we've been sending to you go to a person that's no longer working there, or so you're not aware of the anomalies. And then when we try to and I'm talking anomalies like individuals that have a middle name of unknown or don't know, or there's tons of stuff. And Justin talks about this once in a while. He can go on and on for a while, but it's very important to make sure that you review those reports, make sure that they are in order and they match what you see in your systems and what's going on in your organization. So just wanted to pop that in. Thanks for the reminder, Justin. And now I'm giving it to Kelly for the MFA.
MFA, multi-factor authentication. It is our favorite topic around here lately, and I'm sure you've heard us speaking about it. It's just that extra layer of security that I'm sure you've all encountered, excuse me, at your bank or your hospital or doctor's office, and it is going to be needed for our system as well. So all providers will need to have multi-factor authentication configured. And there's been some changes, and it can be a little tricky. So there aren't any step-by-step guides available right now. We're working on those. But in the meantime, OIS is offering MFA support group sessions, and they have these group sessions and also one-on-one sessions. And you would be paired with a tech support that will get you all set up and answer any questions and get you going. And we highly recommend those. They are so helpful. And there's a lot of dates available. They add sessions every 2 weeks. So we have some links for you. And if you look and don't see something that works for you, just keep those links handy and keep checking back because there will be more dates added and more times. So that is such a great option to get you going for MFA. One thing is that if you do not have a P number, you will need to have a P number. And I believe Jody will be speaking more about that next and have some more info on that. So thank you, Pete.
Thank you, Kelly. Let's check. And it is EDI provider road section. Yeah, Jody.
Oops, sorry, wrong
Slide.
Having some slide technical difficulties. There we go.
Nice.
All right.
Go ahead,
Super.
Jody.
Okay. Sounds good. So, for many of you, while you're using MOTS with EDI, they're really, you don't log in as much, and you may not even have what we call a P number, a partner number, because you're not logging into the MOTS portal, right? So with roads, as Kelly mentioned, and with our current portal users in MOTS, they're having to get MFA set up. So, and I want to say thank you to all of you that got very excited and signed up for MFA. And we realized quickly that we needed to make sure that you knew, or that we got it done first, that you have your P number, because you cannot get MFA set up without it, because that is actually like your username. Your login is what we call this P number, a partner number. And so what we're going to want to do first is to make sure that you all at your organization that are doing MOTS and roads, so especially your primary person and ideally a secondary person. Not everybody at your organization needs these, but at least a primary and secondary is ideal. And we need to kind of know who those are, so you can send a deal to MOT support and myself, and we will look up and see if those individuals have a P number already. You might have had one from way, way, way in the day and it's just disabled and we need to reactivate it. So once we get some information from you on who needs access to roads, right? Because that's where you're going to get all these new tools, dashboards, ways to kind of look at what went on with your file. Basically, we want you to send us an email at MOT support and myself, and we will, with the two names of the individuals, and we will look them up to see if they're existing. If they're not existing, or for sure that you're not existing, then we will send you an email that gives you these steps to fill out that said form, which is actually in the chat. These folks are just on it this morning. So links are in the chat, so you can always grab that as well right now if you want to. And so there's like a 2-week, 3-week process to get your P number. Once we get the form back, so we get it off to our service desk OIS folks, and they help us get that all set up. And then once your P number is set up, then you'll be able to step through some processes to get the MFA set up, whether that's a one-on-one session or if it's just part of the onboarding of your new P number. But you really want to start, we're in Q1, we're in 2025. So the sooner we can start kind of getting ahead of the P numbers that you need. You will need these in order to be trained on the roads system, to use the EDI functionality and the functionality that'll be available to you. So I would definitely recommend start giving that some thoughts, and let's start making some movement on that. So yeah, I think I've belabored this enough. To sum it up, we need to have your two people, and we just need to figure out, do you have P numbers, do you not? And if so, we're going to take next steps to make sure we can get you into the new system. So don't sign up for MFA sessions if you see them in the newsletter until we verify if you've got one and it's ready to get MFA'd, if that's a term. So, anyways,
It is now, Jody. MFA.
it is now. I make
Thank
up
you.
all kinds of words.
I I love that. I'm going to use MFA now in all my communications. That's great.
Oh, goodness.
um, hey, Pete, I actually have a surprise slide. Somehow it got missed. I don't know.
Oh,
It's, a new year. We're just figuring things out. But I have an EDI troubleshooting slide that was not in the agenda.
ooh.
If Jody would like to just keep on telling us
Oh,
about all these wonderful things.
oh, sure, sure.
Sorry about that.
Oh, no, no worries. So the EDI troubleshooting is really kind of, what Justin was saying about, and Pete about keeping your data up to date. It's really important when you submit those files that you actually look at the results files that MOTS returns to you. You usually submit them, say if you did it yesterday, this morning, you should have a results file in your outbound folder on the FTP server. And getting those and opening them up, you can either open them up in a web browser. We have some instructions, some specific instructions on how to bring them into Excel, which is actually really nice because then you can do some different sorting, and it's a little easier on the eyes depending on how big your file is and how many errors or information you may have gotten back. So make sure, if you're not familiar, if this is like, what is a results file, or I haven't heard of this before, get with either your main contact at your organization who does MOTS if you're not the primary, or just reach out to myself and MOTS support and we will help you out with this. But essentially, when you send us a file, MOTS goes through it, and if anything is not holistic, if it doesn't have all the information that we need or doesn't meet the rules, we kick it back to you with an error. So anything that you see on that results file for an error has not been accepted by MOTS, and it will need to be corrected in your system and then sent in one of your next files so that we can actually get that submission in its entirety correct and be accepted. So they're really important. I know some folks have different cadences or frequency that you're submitting your files, but the most success I've seen from organizations, even very large ones, is they submit weekly. They just submit their status files weekly. They work their results files. And by working the results files, you're basically looking that up in your system, determining who or what needs to be changed and making those modifications, or ensuring that your staff or a clinician, or depending on what field it is, you might have to have a certain specific person like the clinician actually make the change, right? So they're just really important to make sure you're working those regularly. And if you get them and you're like, I don't understand that error, or I'm not really sure, again, just reach out to us. We'll help you out with that, and give you the clarity you need, or connect with you for 15 minutes to a half hour, whatever you kind of need to get going. If you're new at your organization to doing the MOTS, you got to sign this. You know, it is really helpful sometimes to just connect with us. Um, what about errors for clients that are not reachable anymore? So there's different reasons that are allowed to be sent for a client for their treatment status. So like if it is, a client you can't reach anymore, you've gone through your processes and your timelines, you could, utilize, say, service discontinued by the facility because they're not reachable. You're not able to get a hold of them. So you did discontinue servicing them because you can't get a hold of them. So like that's an appropriate error for that one. Sometimes, you can determined that they left against professional advice. Like that's another one that's in there, you know. There was transferred to another facility, maybe, you know. So, but for not reachable, I think service discontinued by the facility or left against professional advice is the main reasons. And that would be like you're telling us like they're no longer active at your organization, like or like they're discharged, like you put in the chat. So and that's really nice too. If you are doing like weekly, we catch those type of situations. And because sometimes people like that might possibly come back before you know it and be like, wow, I didn't have a phone, whatever happened, right? And they're back. And now you need to reopen them with a new admission date. And if you hadn't closed them with their prior date, right, then MOTS will have a conflict and give you a new exciting error. So we definitely, those are the steps we recommend. If you do have some folks that maybe you don't have a way to get them closed or something, or you're looking at your active client monitoring report, like Justin said now, and you're like, oh my goodness, like, why do I have, like, why do I have 30, 40 people here that haven't been updated in 3 years? If you need to have some help determining what that is, why that is, or help even closing them, we'd like to recommend that you look at those active client monitoring reports and we get a strategic plan for you to either get them closed with your system prior to moving into roads, or that we assist you with some of those closures before we get into roads. Once roads is up and running, we're going to be, you know, here to help you, of course, but we're going to be, you know, hyper focused on getting everything moving there. And so we can still assist with things, but it just may be a lot longer lead time than it would be if you asked us to do it in the month of January. So, okay, and Justin's doing some replying there. Super, super, super. The cool thing with the road system is there will be some area in there where you can look at part of your submitted files, and you can drill down into the client from there to in a read-only fashion to actually see what was accepted by MOTS and actually see some, you know, past reportings on your clients where you haven't been able to. You're gonna have some dashboards. So there's some really cool things that are going to be available to you that you didn't have before. Okay. I think I got that blanketed real well.
I think
Jody,
you did an excellent job, Jody. Go ahead, Mary.
there's one more question about will we have a copy of the data dictionary before roads go
Okay.
live? If
Yeah,
so,
yeah.
when is timeline for
Okay.
that to be sent out?
So when MOTS goes live, MOTS is going to be accepting the current,
Roads.
oh, excuse me.
Sorry.
You know, I burned off a lot of my neuron firing in like the first meeting. It was like, it put me to the test of my knowledge. So, okay. Thank you,
Sorry.
Pete. No, no, this is why we're a team, right?
Yes,
Okay.
definitely.
So when roads goes live, you all will continue to send your MOTS EDI files like you do today into the FTP. Roads is going to be using the MOTS EDI files upon go live. We will continue to accept the MOTS files until the point in time that has been determined after the release of the new roads EDI version 2, okay, to your EHRs, to the providers, and we get the feedback and timelines on the development and the spool up resources. We know that that could be up to 12 months from the time of publishing it. We have been keeping the EHRs up to speed on the fact that we do not have those documents published yet to the public. We obviously have them in the works. So, but they're very intensive. And it's really just more trying to get all of the accuracy, everything's in alignment. So on go live, you're going to continue to use the MOTS current data dictionary. And just so y'all know, for V2, if you haven't heard this before, we built upon version, what we're calling legacy mods. We built upon that format and structure to just add to that for new data elements that we need, new fields that we're going to capture, such as like discharge date, lasting date, a substance use discharge date, like if you're doing co-occurring treatment, right? We've added some things in there to make the data more meaningful and able for us to report out on. So it won't be a 100% overhaul for your EHR vendors, and we have been telling them that. And so that'll be good news, but it's still, there's an element of time that it's going to take, and we understand that. So go live, use the MOTS current data dictionary, and for EDI reporting.
Thank you, Jody. Yeah, and also what I just wanted to add that when you talk about errors on clients that didn't make it through the business rules that are still in the system and you can't reach them, it depends on the error, and we gave some examples of issues that might pop up that we might be able to help. But other errors, sometimes we just have to answer certain questions with unknown or not applicable and things like that. It all depends on what the situation is and what the individual is doing. If they, like you said, they have been there before or not, or they go into other places, or we usually have many ways to find that information. So, okay, thank you. And I think I'm giving it back to Jody again, because she does our usual spiel about switching from CE to EDI or from EDI to another EDI.
Exactly. And yeah, Justin, thanks for hopping on that question. Yeah, no, if you're currently client entry, you do not need to have to go to EDI. Your organization can choose what type of data submission that you would prefer to use. But as Pete mentioned, when you're switching EHRs, in the 10 years that I've been here, well, 11 now, I guess, coming up here in another week or so, there's always, a new product, or there's new requirements at your organization. And so you find other solutions that might work better for what your needs are. So if you are thinking of changing your electronic health records program, or you are moving from your currently client entry and your organization is looking at a new EHR system that has MOTS functionality, let us know first and foremost. That's why that's the one part in bold. Just let us know if it's on the horizon, if it's fast tracked, if it's planned out in the 12-month plan or whatever. If you are looking at different EHRs, in that point of like investigating what is going to be best for you, a lot of them have MOTS functionality. And so what we have got as feedback from others is, these things here, like when you're looking at these and they have MOTS, like ask maybe like, what is the business process for this functionality? How does this piece of their system work from the time the client comes in to actually getting it submitted to MOTS or roads, right? How much time is going to be required? Who's going to do what? And there's always this myth that once it's EDI, everything is fully automated. Well, even the fullest automation that we've seen, there's still somebody kind of overseeing the functioning of what's happening there. And so you just want to be aware of that, so that as you go live and you do what you're doing, you kind of know who's going to be doing which pieces. There's no one way that's better than another. There's just differences in workflows. And that's typically why you all are looking possibly for a different solution, is because you've got different needs that you are trying to meet. Once you get things kind of sorted out, we'll talk about your project timing. We'll talk about the process for switching data submission if you are currently entering through the portal. If you're not entering through the portal, we will expire the certification on your existing system, and you will get recertified with the new system. The certification is done at the system level, not the organization's level. You'll use secure file transfer protocol location on our server. If you're already EDI, you're going to continue to use the same one. So there is one setup for your organization, and regardless of which EHR you use. We even have some who use two, and they just put them in the same location. The system sorts it out. Client ID considerations we'll talk about. When you go to a new system, oftentimes you have to update that client ID number because the new system auto generates it, and that's what is actually sent in your data file to our systems. If we've been there, done that many times, so we'll have the best path forward once we kind of know what's happening. Define your business processes. This is just something we mentioned because having those done ahead of time, or at least your eyes around them, really helps you as you're lifting off this piece of your implementation. You are going to test your files through EDI. So even if you go with a system that already is got other customers submitting, we test and certify at your organization level because of all the customization and different setups and things that you can do, right? We want to make sure that all the mapping and everything is correct. We'll go live, and we'll then, the exciting part happens with some follow-ups, and those are really to help you go through your real-time results files, your live data that's coming in. Those can be weekly, bi-weekly, monthly, and they can get sunsetted, of course. So yeah, we just want to make sure we're here to help with this transition, because the smoother it is for you all and for us, the smoother the reporting and the impacts to the clients will be as well. And we can try and minimize as much as possible. So with that, I will kick it back to Pete.
Thank you, Jody. And you mentioned daily, weekly, bi-weekly. I think we recommend weekly for
Oh,
submitting your
well,
files, because the longer the time period, the bigger the error file can
oh,
be, and the more difficult it can be to kind of keep track of stuff. So
yeah. So what, I probably mixed stuff there. So for the file submission itself, weekly really has been um, the best that we have seen. It has minimized the amount of time every week it takes. It's minimized the error rate because it's just, and then if something happens, right, like maybe you're out sick for a week, you're on vacation, you don't have a backup, whatever that is, if you miss a week here or there, is not, it doesn't have the impact if you're doing it not as frequent. So what I was trying to say, and I probably got it confused, is that on the follow-up, like once you're live and your files are coming in, we can set up connects with you and your vendor and us, and we can look at your files that you're submitting weekly and help you with the error, because everybody's going to get some errors. So that's just kind of the way it goes. It's okay. 80% error rate is not great. 5 or 10%. There can be legitimate reasons these things happen. Um, and so we're just going to help you know what those are. And those follow-ups, we can schedule them at the frequency that you feel and your vendor feel that are the most appropriate for wherever you're at in the project. That's what I was trying to say. There we
excellent.
go.
Thank
Yeah,
you, Jody.
you're welcome.
I'm just trying to take a quick look at the chat because I saw some things popping up here and there. I've been entering every week for 12 years. Nice. Thanks, Michelle. Okay. The next one on the MOTS team. Hey, those are nice pictures, aren't they? I think we were looking for the Q&A slide, Kelly.
It's the intro to
The
MOTS.
intro to MOTS. Sorry, I
Yes,
was running through the thing already. Go ahead.
which
Sorry.
is me. Yes.
Yeah.
Yeah, so we have an Intro to MOTS webinar the second Wednesday of every month. And this is great if you are new or anyone on your team is new and you think they could benefit from it, or if you just need a refresher. It's designed to onboard new MOTS providers or provide guidance, and it explains kind of the reporting responsibilities for agencies. And we have a big opportunity to ask questions and get clarification. And then there's also a demo. So this is a great thing to join if you need information on MOTS. And we have one coming up on the 15th from 10 to 11, and you can register, and we'll put a link in the chat as well.
Excellent. Thanks, Kelly. Yes, and everything in MOTS, almost everything, will be into roads. So if you want to be ready for roads and you haven't been introduced to any of our systems yet, then MOTS is a perfect way into the system. And talking about data, it's always very important how important it is. So it's a very nice introduction to everything. The system will look and feel different, but everything that you can find in MOTS, you will find in the new road system. So,
Great.
thank you, Kelly. Now the Q&A. And although what I like about the new concept of our webinar is that as soon as people have questions, they throw them in the chat. So are there any other questions that we haven't answered yet? Yes, I saw a hand come up. Go ahead, Lydia.
Hey there. This is Lydia from the BHD at the Multnomah County. I have a question about an email that my colleague Christy has been getting about a password expiry, and we don't know for sure if it's from you guys, for sure if it's a phishing attempt. So I'm wondering, can I forward it to one of you, or I could even just sort of describe what it says in the email. It's from a weird mix of letters and numbers at das.oregon.gov.
Yeah, so Lydia, thank you for bringing that up. That kind of escaped my mind. So for years, the FTP server did not have any type of notification to let folks know that your passwords were going to expire. And somehow, due to one pocket of large group wanting that ability, they turned it on. So that is legitimate. Okay. If you want, send it to me anyways, and I will double verify that it is legitimate. But those have been starting to go out. When you get them, that's probably like your note to say, hey, let's email Jody or Mott support. I need a new password.
Okay,
I've heard
there is a link in it though.
There is a link in it, but I've heard from others that they haven't had as much success actually utilizing the link. So for expediency, it might be quicker to just get a hold of me. If you want to try the link and it works for you all, definitely by all means go ahead and do that. But at the end of the day, it is legitimate. It is a new thing they've been putting out in the last like 2 months or so, because I got one as well the other day. Okay. And so, yeah, but thank you for bringing that up, because that totally had escaped me. So,
and
I'm so glad, because yeah, we were worried that it's very
oh, it's real cryptic.
No offense, but it's very fishy.
Yeah, it's so cryptic looking, and you're like, is this thing for real? And it's like, yeah, it's for real. But yeah, awesome. Thank you for bringing it up.
So it's maybe something we should work on, Jody, to make it look more official.
Well, the thing is that it's coming from DAS, and it's an auto-generated thing. And so I don't know that we even have I don't even know if it's within our capacity to change, but we could talk with Michael, our point person with the FTP stuff. I know he was surprised as well when I asked him. He's like, I don't, he was even caught off guard by it. So but yeah, definitely something we could take back and see if there is some capacity there to make it look more friendly and legitimate.
Right. And it's nice to have, because we all know Jody has been excellent and usually very good staying on top of passwords and stuff like that. Once in a while, one slips through, but she's always on top of things and she has all these nice reminders when things expire and stuff like that. So she's working very good on that. But with all the new road stuff and everything, it's nice to have it automated just in case one slips through, that you can kind of hopefully in the future start doing those things yourself. So, but
Yeah.
it's not fully automated yet. So yeah, just definitely contact us.
Yeah.
I saw Michelle raise her hand.
Hi, how are you today?
I'm good. How are you, Michelle?
I'm good. First of all, I just want to say I'm really glad Justin's still there. He's been with me for 12 years. So, again, thank you. Recently, Turning Points Recovery Services has been brought under the umbrella of um, New Priorities Family Services. Mary did get me added to the facilities or the agency in MOTS. However, when I go to add a client, to add a new client, I don't have any drop downs to be able to do that. I have no place to enter anything.
So when you add a new client to a new facility, Michelle, it won't show anything. You have to do a search first for that add a new client button to appear.
Okay. So when I click on the New Priorities Family Services,
Mhm.
there it does bring up like a list of clients.
Mhm.
But when I go to click on add new patient, it
Yeah.
doesn't give me anything. So,
You mean that's because you've got at least two more than
yes,
one agency and facility. So you have to select the agency and facility first before it'll put stuff
okay,
in or show you
right.
what you need.
So yeah, so we have New Priorities Family Services. Um, okay. And then it's just like before, enter the last name, first name, Medicaid ID, and gender, and then click on add new patient, right?
Yes.
Okay.
Yes.
All right. I just it looked like it was missing something that I couldn't get to. So
Okay. It's just a
yeah.
few extra clicks that you need or fields that you need to add in to front load it. So,
Okay. All right. Well, thank you very much. If I have any questions, I will email.
okay. Thank you.
Excellent. Lydia, you still have your hand up? We had another question or got
No,
to take your
sorry.
hand down? That's okay. Cool.
They don't go down automatically, so thank you.
No, yeah, they should, don't, shouldn't they? They kind of just sit there, and once you've started talking, you should pop more improvements for the Teams thing. Okay. Okay. I'm not seeing anything new at the moment. If something pops up, let me know. As I mentioned at the beginning, there's a recording of this webinar, and it will be under the MOTS website still. And that will change, of course, into roads, but webinars and newsletters, because we also have newsletters once a month. The Roads Navigator is also out there, and all our dates for future webinars and are on that, so should be on that site. And the next one is February 5th. And an easy reminder is the first Wednesday of the month from 9 to 10 is the MOTS/Roads webinar. So sign up should be there on that site, and hopefully we'll see you there. Thank you for joining us today. And the next slide has all our info. The most important ones, of course, are the mods.support and the road support. It's roads without the support, but it is for road support. Why do they change it? Never mind. Sorry, that's just my OCD kicking in. Sorry about that. Kayla, Cecilia, Pete, Mary, Jody, Justin, Anna, and Kelly. And I am missing someone, I think.
We'll have to add Lisa on there.
Lisa, that's what I was
Mhm.
saying. Yes, Lisa's not there yet because she's part of the
Oh
team.
my
So,
goodness. Yes, I
hey,
will add
just
her. Wow.
Thank you.
cool. Okay, so yes, any questions, issues, please go through the MOTS or road support because those mailboxes are watched by several people. If you try an individual and they just happen to be on vacation or out sick or helping a family member or somebody else, they won't be able to respond, and you'll just sitting there and waiting. The support sites, emails, should always have somebody in there. So, okay. I think that was it. Did I miss anything? I'm not seeing anything. Okay. Well, thank you all very much. And as I said, hopefully we'll have a wonderful 2025. But for now, have a wonderful rest of your day. Thank you very much for joining, and hopefully see you next time. Take care. Bye-bye.
Thanks, everyone.
Thanks all.